This is the Fresh Start Project, where we explore the growing loss of trust in societal institutions and how we can break free from broken systems and move forward towards something better. I'm Christian Misluik, and my guest today is Tanner Aliff. Tanner is a healthcare policy manager at the Cicero Institute, which is an Austin-based organization founded by entrepreneur and tech investor Joe Lonsdale, dedicated to innovative public policy solutions to state-level problems. Tanner's research primarily focuses on developing healthcare reforms, address price transparency, restructuring incentives for hospital community benefit requirements. You just wrote an op-ed about that, really interesting stuff. Improving the utility of electronic health records. That's another thing we should talk about later today. Tanner has served as a research fellow for Congressman Mark Green and as a constant observer at Providence Health. Before switching to health policy, Tanner researched cognitive interference, incongruent stimuli, attention, daydreaming, memory. He won an award for undergraduate research at the Western Psychology Association. Tanner is a John Jay Institute Fellow and a member of the American Enterprise Institute's Leadership Network. His op-eds have appeared in Forbes, City Journal, The Washington Times, Washington Examiner, and others. Tanner, welcome to the show.
Thanks for having me, Christian. I've been so stoked all week to talk about this.
Yeah, this is going to be great. I mean, you and I, we go back a couple years now. I think we met during our respective tours of duty in the swamp, Washington, D.C.
Oh, yeah, getting connected. You're one of my first mentors, Christian. It was fantastic. And look how far we've come. Who thought?
Who would have thought, right? In those pre-pandemic days, right before the pandemic. Yeah. Now, healthcare. I have to admit that this isn't generally a topic that I find very interesting. Every time I change jobs and I have to choose healthcare, it's like, all right, I want to read the least amount of stuff right now. So I'm just going to sign up for the basic plan because I think I'm healthy enough and I don't have any dependents. I just trust that my insurance card will come in the mail. And I think a lot of people are kind of in a similar boat. They have a similar attitude towards healthcare. You do not have this attitude. Every time we talk about this topic, your eyes just light up and you're passionate about it, and you're very passionate about how we can improve the healthcare system. So I'm really excited about digging into this topic.
Christian, this is like I'm glad you brought me on because I'm so animated. Like, there's just so much potential. Like, I think it's really hard to talk about trying to get a reference for like the quality of the care or picking doctors, but something that's like in people's control where it can make a huge difference for your like wallet and also like economically speaking is like just picking health insurance and talking about the financing of it.
Yeah, exactly. There's so many ways that people can optimize their decisions that I don't think they're aware of. So we need to change that.
We do.
Yeah. But to start our conversation, I want to read a quote. This is from actually a mutual acquaintance of ours, Aliz Ahmed-Dro. She's at the Mercatus Center. She recently wrote this for the National Review. Let me quote. "The beginning of 2023 represents an unfortunate milestone. All millennials are now 26 or older and, per federal law, are no longer covered by their parents' health insurance. The generation is officially on its own, and it's vastly overpaying for insurance." All right, that's an interesting quote. So now that every millennial on the planet is now responsible for their own health insurance, and in the US at least, it's a pretty good time to ask, are millennials getting the bad end of the deal when it comes to health insurance?
Great question. And also for the folks tuning in right now, definitely like check out Lisa Medro's work. Her and I have commiserated on this exact question a lot. So she's she tries to make the connections for people. So, trying to actually make it relevant in their lives. So it's not boring or over like too much like overload and information. So highly recommend her. But to answer your question directly, yes. Millennials, Gen Z people not on their parents' health insurance, really anyone under 64 is probably overpaying or they're buying too much coverage, when it comes to health insurance. And before I kind of go into like the whole tirade as to like what are some of the key features I can point to say indeed that millennials are getting the short end of the stick, is that there's kind of two things I want to talk about. One is that I don't think a lot of Americans are starting to realize that like health insurance is not insurance, right? like by definition, like health insurance, or sorry, like insurance is supposed to be where you pay money to an organization to cover you for an unlikely event, right? Like with life insurance, literally death, or auto for a car accident, right? Like insurance companies make money by like knowing the probabilities, knowing stats, doing the actuary assessment, and realizing that the people that they have on their policy are so unlikely to use like the most like to like where the insurance company has to pay out their service that they're going to make a profit. Health insurance is completely different, is because we almost feel it's like automatically required with or without the Obamacare mandate, right? Like people just feel like in order to get prescription drugs, to get like appointments at their primary care doc, going to the hospital, their urgent care, they feel like they need this thing, right? And that is like a huge contributor here, because that's made it like way more overbearing and middle managed than it was ever supposed to be. The second thing I kind of want to point out too is that the second theme is that Americans are really surrendering their consumer power. And when they let their employer, or when they let their health insurance company like set deals for them and pay for their health insurance, they're actually limiting themselves, and they're setting up themselves up to fall, economically speaking, in the future, right? And there's just no influence. It's because those groups that you're giving that power to, that consumer power, don't have your unique healthcare interest at heart, right? Because they have their own incentives, they have their own accounting, they have their own problems to deal with. So just wanted to kind of prime that when we go into this. So, but like to get to the meat of this, right? It's just look at your pay stub, right? Out the gate. Like you'll see, you have your income tax, Social Security, and then Medicare, right?
Yeah.
It's really interesting, and I bring this up as like a feature of why I'd say millennials aren't getting a good deal right now, is because like Medicare, the idea was like Social Security was to give some elderly folks, once they reach that age and they put their time in, they pursued the American dream, they did all that labor, that we would compensate them in taking care of their health needs as they got older, right? But the problem is that healthcare is really expensive. And even the federal government cannot shield itself from all those costs. And we've seen tons of people enroll more onto Medicare and Medicaid and some other various programs. And as a consequence, taxes increase, right? And it's to the point where we're paying so much, like you and I, Christian, our age group, are paying so much that it's completely unfair, in the sense that most people in Medicare, like for every $2.40 they've spent, they're getting $8 back that was never their own. And by the time that we reach 65, I don't think Medicare will exist, right? We're paying to, like, the people that are supposed to pay, like, have paid the program, are no longer getting their own money back to them. It's our money. And so that's just like an overhead thing where a lot of people don't realize when some of these government programs, is that it'll take your disposable income away, and it'll nick you, and it will just cause you to be ever so on the downward trend. And it's just kind of one of those unnecessary things. I'm not saying we cut Medicare for elderly people either, but like just realizing that you're getting money pulled from you as a young person because you're not like the biggest consumer healthcare all the time.
Yeah.
So,
but is the reasoning that by time we're like 65 and older, we'll be getting paid more of our health care costs will be covered by the younger generation in the year 2053?
So Elise mentioned that article you talked about, Medicare insolvency. Like, it's like the trust funds holding like all the taxpayer dollars is literally quite running out of money.
Yeah.
And so there might not even be a program by the time that happens, if current trends persist. But yes, if what you just said is true, it's like, I believe that if you and I got to that age, we won't see a single one of our own tax dollars come to pay for our own healthcare via Medicare.
Wow.
Yeah, it's getting pretty bad, and it's just a top level thing that people just need to be aware of. And it's more of a call to be like, look, this is a program with a noble intent, but there's plenty of ways to optimize it and not have it pay out so much money, and then create a regressive tax, so to speak. So the one thing I want to point out too, this will be the most pertinent, is let's talk about employer-sponsored health insurance for a second. So,
which is where like half of people get their coverage.
Yeah, 49%.
Your job, 49.
Yeah, 49%. One thing I want to point out is, since that's the primary mode, if you're not on like a government form of health insurance, that's what you're getting. There's like a small thing called the individual and small business market, but I think it's dwindled past 8% now, down past that. So very few people actually have it. Most of it, if you're not like getting Medicaid, any health service on the VA or Medicare, you're getting insurance through your employer typically. Mm-hmm. And the problem with that, as you said, like right from being in the intro, is like, it's not portable, right? Like some of the worst things will happen to you as a young person, like where you'll be even between jobs. Because like for me in policy, people switch jobs all the time. It's a revolving door, right? Mm-hmm. And it's in that switching that you'll create these little pockets where you are uninsured. And if an accident happens or unlikely illness comes down on you, you're on the hook for it, right? And that's like one thing I get a little bit frustrated like with millennials trying to talk about this is like, you should be concerned that your health insurance is married to your employer, right?
Yeah.
Like, because if that goes out, you're on the hook. And if you're not even picking your health insurance in a meaningful way with your insurance company, I don't know if you're going to fare well if you're uninsured. And so realizing that it's portable is a big issue. The other thing though, is that a lot of Americans for like the last 40 years have become alienated from understanding how their healthcare is paid for, right? You're saying it's like, it's inconvenient. It's not a task I want to deal with. I'm just going to give it over to somebody else. Mm-hmm. And
which I'm not proud of, but it's true.
Don't worry. I'll give context that might change your mind a little bit later.
Okay, but, good.
Is that these employers, right? You as you got a new job may have been given like 4 options, right? 5 options. And you're like, oh, I get to choose my health insurance. Isn't that so cool? Mm-hmm. To me, that's more of an illusion of choice because that's not getting the full snapshot of what's really out there, right? Mm-hmm. Like check this, right? I think I was looking at Kaiser Family Foundation and some other great research orgs. And I think the average for an individual they spend on premiums, not the deductible, premiums alone, their health insurance is $7,739 is the national average right now.
Oh, wow. That's annually.
Yeah, that's annually. Sorry. Yeah, that's not per month. That would be terrible. It was per month. But, and the question is, but like, as I've like worked with some of these companies out there and some health insurance companies, I've looked at data sets myself, right? Like 2 million plus or 306,000, right? I've noticed a crazy trend is that like between 85 to 75% of people in like a risk pool do not actually hit their deductible. Meaning that you're on the hook the entire time, yet you're also most likely paying $7,000 in premiums every single year.
Okay, so let me interrupt you. If somebody was reasonably healthy, but they are prone to the same acts of God, disasters that anyone else is, like you get into a car accident and you need ER care. If you were not insured, but let's say you were responsibly squirreling away a little bit of money from each paycheck on your own, would you be better off doing that and safeguarding against expensive but rare catastrophes that way? Or is it still better to be insured, even though it's not ideal?
For trauma kind of related instance, I'd probably say not. But if like, for example, like the Oklahoma Heart Surgery Center is like a new type of innovation that we'll probably talk about later, where it's like they're charging like $7,000 for heart procedures, $5,000 for knee replacements, right? Like there is like, we're starting to see the rise of some providers that could kind of meet you in those savings that you're talking about. But, the real solution there would be just to go on to more of a catastrophic or high deductible plan with like a cool thing, like a health savings account attached to it. But just to kind of point back there, but like the point being still, right, is that I talked to so many of my friends here and they've said like, oh, like I've gone to the doctor 2 times last year. And I'm like, how much did you pay in health insurance, like premiums? They're like, oh yeah, I think it was like $4,700 or $5,000. And I'm like, you paid $5,000 just
for
to, like,
2 doctor's appointments.
Yeah. And like, their healthcare, like they live decent lifestyles and they're not going to change. And I just pointed out to them like, hey, like it's cool that you have health insurance and power to you, but like at the same time, you are taking away so much more disposable income that you can throw in different ways to grow yourself as a person, right? Or just do whatever you want to do. And like, they're like, what do you mean? I was like, well, quantify that out. Like literally like 2 visits, $5,000, you're paying $2,500 per visit. Does that seem reasonable to you? Like you can go into an HSA or you can go into like a program, like a crowdfunding program or a health shared plan that would like cost you way, way less, and you'd be better off for it.
So let's get into that. Let's get into
Okay.
the other options, because it seems that it's not ideal that we're dependent on your employer for employer sponsored care, healthcare. But like you said, we only have the illusion of choice when we go that route. It's really whoever is partnering with the employer.
Mhm.
That might not be the right terminology, but you know what I mean. Like,
Yeah.
well, how, that's actually a good question. Why do we have only a handful of options? Why are we only given a handful of options by an employer?
Mhm. So, what I'd probably say is that, look, your employer is balancing probably like three different factors, right? Like one, they're probably providing benefits because they're required to if it's 50 people or more,
Mm-hmm.
or they're having an acute interest to maintain talent, right? Like they want that benefit to bring people in. The other thing is that you're also trying to account for like because employers get a tax write-off when they spend on their employees' health insurance. So depending if you do your accounting right, you could walk away like saving some like some costs in other areas by like providing a more generous package. And then also it's really they're about mitigating their own overhead, right? Because like they're willing to spend money, right? Because there's the tax write-off, but it's usually up to a certain extent. And so they're probably not going to get always the most robust plan. All those things I just said, though, have nothing to do with your healthcare needs, though, right?
Right.
Like they're just finding an HR department, or they themselves are going out and they're like, hey, we need plans. And they like will talk to Anthem, United, or Cigna, or Aetna, or whoever. And then like they get into a large group plan, and then you're given three options, right?
Mm.
And that decision had nothing to do, like, I mean, like, have you ever been like, has any employer ever given you like a de-identified health survey?
No.
Right. Like they're not accounting for what matters to us or our family's needs or like,
DM5, that's the psychological evaluation.
well, de-identified meaning because I think people don't want to share their health information with their employer. But I mean,
Oh, I
like
see.
but imagine like if an employer was just actually like trying to be like, hey, we're trying to pick health insurance. We want to get the best bang for a buck, but also make sure that all your health needs are met. Right.
Mm.
But no one does that. Right. Because then that only tells me that it's like, that's not the primary concern here. It's like, you're kind of downstream as far as a consideration goes. The only thing that's really in our interest is that like people want to invest in health insurance as an employer just for talent retention. Right.
Mm-hmm.
So again, why we're kind of seeing this like limitation of choice is just because they are just going to go onto one traditional group plan. They might be self-insured, and they might get a thing called a third-party administrator that rents a network for them. But these are all things that have nothing really to do with your own like options and your choice, right?
Okay. So let's go back to how individuals can have a fuller range of options and choose something more appropriate. What
Yeah.
what do most people not know that they should?
So, I mean, I'll talk about some alternatives to health insurance for sure. So, there's this darling company called Crowd Health here in Austin that I have just completely like support as far as like its mission and what it does for the economy. So Crowd Health is unique, right? Is that it's a crowd sourcing, crowd funding group, right? So
Mm.
like say that you and I, Christian, we want to get into this program. We pay $30 a month for like the app and usage. And then we sign an agreement to put $150 of our own money into our own account called a generosity account. And that's all that we see on that end. So $180 per month, right? Which is a good number. Like I gotta think of it like premium wise, like the average is $600 plus per month. So
Mm.
180, good deal for you. And what happens with Crowd Health? So say, Christian, that you get you're playing pickup basketball and then you tear your meniscus and ACL.
Could happen.
Terrible. Could happen, terrible, right? But what's going to happen is that you're going to go to an orthopedic surgeon, you're going to go to the hospital, and you're going to ask, they're going to do the assessment, and then they're going to ask, you're going to be like, give me a quote. I want to know how much is this going to cost me out of pocket because right now I don't have health insurance. And then you're going to get some crazy made up number like $67,000. It's going to scare you.
Yeah.
But then you go onto your Crowd Health app and you just type in that amount, and then usually less than, they're pretty good at this, less than 48 hours, they will find in your area. And if it's not in your area, somebody who's willing to do a cash service for disproportionately cheaper. I've heard stories where they say that one person needed a heart procedure over in Wisconsin. They found them an option. Ohio flew them first class, covered their board, food, comp, everything. And it was a very vital procedure. And they were initially billed, again, 83. Crowd Health was able to find them an option. I think it was around $15,000 or $14,000. And the cool thing that happens there is it's crowdfunding, right? So while they're looking for that lower cost provider that with great quality, I'm getting the notification that Christian tore his ACL and meniscus and I use help, and I get this cool option to give you money, right? And there's an accountability score. So usually people like it's kind of cool. I don't think anyone has lower than like a 7.5, which is pretty high for like their metric system, which means people are always giving, right? They want to support one another because the more likely you are to give, the more you're likely to like get back, right? And so I would give you money and you get all that money crowdsourced to you into your generosity account. And then you would be able to spend that and pay the doctor who's happy to lower the price for you because he doesn't have to file a claim with health insurance. So it's a really cool ways because it's actually like reducing health spending in general, like across the national economy. But it's also kind of like showing that like when you remove some of these middlemen out of the equation, like we can get to a price that's workable. And there's innovative ways to have a community support one another to actually pay for other people's health insurance or like healthcare costs, I should say.
Yeah, that's a crazy idea. That's really interesting. So if you incur a medical expense and you're on this program, you do have to rely on other people who are using the same app to donate.
Well, I would point out that's what you're doing in traditional health insurance, though, aren't you? Like you're just blindly thrown into a risk pool. But like,
there's that the insurance company itself is ensuring that nobody would not have their expenses covered.
I mean,
but I get the point. Yeah.
Well, I think it works well right now in the current model is because I think people do have a philanthropic backbone in them and they want to be able to help out. And it's so cool when you get to see in the community, knowing how your dollars are actually helping somebody. And also if this is like one of your lifelines for getting like actual coverage in some form or another, or a way to finance your healthcare, like it seems like the feel good, do good phenomenon really takes effect here.
Yeah.
So
it's the difference between doing something voluntarily versus compulsive. You're compelled. Like I don't feel good because I pay my, insurance fees. I don't feel good that other people are getting like cancer treatment or whatever is being paid for when I pay my insurance. But if I could see in an app that Tanner needs to repair that meniscus and I like voluntarily have my generosity fund go towards that as if it was like a Venmo account, I'd get that dopamine hit. I'm just wondering if somebody who has a reputation for being like hated tears their meniscus and nobody wants to donate to them.
Or no, I guess the funny thing is like if you saw the same person's name with a bunch of meniscus tears because they're not like following the rehab protocol or something.
Oh, right. Yeah.
Yeah. No, I think there's checks in that. And I, it's like, again, I just heard of Crowd Health and I've talked with the founder a couple of times, but they're like accounting for all that kind of stuff. But like, as far as like an innovative concept that's actually been like able to grow, right? They went to Series C funding not too long ago. So they're scaling up and they're getting more people and they're showing success. And I think like it's really countercultural though, right? Like you're having like some big questions like, oh, what happens if there's that one guy, or is like, does voluntary really work?
Yeah.
They're showing it's working, which is kind of cool, right?
Okay. That is awesome.
Yeah.
And is there any penalty for not giving away any of your generosity fund as you fill it, like if you're just keeping it?
Yeah, I think I don't know what like the algorithm or the software stuff how it actually works, but I imagine it's like if you have repetitively said no or something, you see like just like how Uber has like a 5-star rating and accountability, right? Like where you, the rider, and the Uber driver get to rate one another. I think the same thing's kind of happening here. It's where the app is keeping track of like how much times are you giving and how much are you asking for.
Right.
And it kind of calculates like an accountability score of some kind.
Yeah. And the generosity fund, you can use those monies for your own healthcare, correct?
It's your money.
It's your money. Got it.
Yep.
Okay.
That's the way that's how they kind of been able to separate themselves from being a health share plan or just traditional health insurance, and why they're not subjected to one thing, like to some of the same regulation. And it's just because it's your money getting put into your own account.
Okay. One more time, the name of the company?
Crowd Health.
Crowd Health. Interesting. All right, interesting. Are there other like crowd health models popping up throughout the country?
I mean, yeah, it's not like Crowd Health has monopoly on crowdfunding and healthcare. I
Mhm.
just think, well, they're local, so of course I found them that way. But
Right. They're in Austin.
I think it is a model that is like showing potential interest. I could see a few others, especially if like the regulation waters are a little bit easier than being a health insurance company that way.
Mhm.
I could see people kind of like trying to do a few startups or put out a venture and see what happens, kind of thing. But it's something that's scaling. It's something that's cool. A lot of people in Austin. It's so funny. I think I ran into people in Austin. They're like, "Oh yeah, crowd health," and I'm just like, "Oh, I didn't no idea." So it's growing. It's fun. Something that's a cool model. I think you'll also like. This is coming out of Maine, near
Mhm.
Portland, and it's called Taro Health. And this thing is really cool because it fuses a thing called direct primary care, like a cash-based model where you pay your doctor directly to take care of your healthcare needs or your primary care healthcare needs, with a high deductible like plan, right? And
Mhm.
the reason that even though like we don't like it, we boo deductibles, out of pocket costs for patients, we don't like that. It's cool here is because what they're doing is usually for a long time, like these cool doctor arrangements, like direct primary care, haven't been able to pair because they're classified as health insurance for some weird reason.
Mhm.
Like a doctor's office giving care is being classified as health insurance. Whenever the doctor takes a subscription, I guess, like saying, "Hey, pay me $50, and then we'll like if you need a test, I'll charge you an extra $10 for that test." That kind of model,
Yeah.
like that's being considered health insurance, and that stopped it, or at least it has created hiccups under the Affordable Care Act to merge with cool stuff. And this thing right here, this Terra Health over in Maine, they essentially figured out a way to get an ACA, Affordable Care Act sanctioned um, health insurance program that, so it's like I don't know the exact deductible, but I think it's up in like the upper thousands. But even though it's like high deductible, your primary care needs, like the subscription you get with those doctors,
Mm.
is getting filled by like every time you pay for them, it counts towards your deductible. And usually the services are so low cost. I'm talking like the subscription fee might be $50 a month. And like if you need like blood work, or if you need like a STI or some other types of tests, like that kind of stuff is like 10, 15, $25,
Mhm.
which is insane because if you can go to urgent care at a hospital, like you like if you're in your deductible, you're probably gonna get charged like 115, 200, $300 for those
Mm.
things. Right. And they've been able to find the right kind of type of provider that is willing to step in and pair with this program. And the cool thing is it's a high deductible plan, which means that like in worst case scenario, like if you get that car accident, you're covered. Right. So most people, like I think like people get so scared and they like,
Yeah.
people have like concern of risk, right, when it comes to these unforeseeable events. But reality is, statistically speaking, very unlikely something like that's going to happen to you. That's just from your own personal assessment. And I mean, like, we can talk about outliers and people with like chronic health conditions, but for a
Sure.
bulk of Americans, that's not the case. And so they get to go into this program like getting the bulk of the care they're actually going to use the most, which is primary care, right? And this primary care is very expansive, right? It covers women's health, it covers like minor like trauma injuries, it covers like basic medications, checkups, recommendations, referrals, everything you really need. Like
Mhm.
that's gonna be like the nexus point for most Americans, is that primary care doc. And it's completely covered. And the cool part is there's concierge service attached with it too. And you get the benefit in case the worst thing actually does happen. Yeah, you'll be on the hook for a little bit. Like if it's, if the deductible is $8,000, that can be hard at times. But
Yeah.
at least it's not like you lose everything with $20,000 you need to file for bankruptcy, right?
Right. Right. So it's like you need chemo. You're not going to go bankrupt.
Mhm. Well, I mean, I'm still parsing out some of the specialty aspects of it, like with
Okay.
oncology and things like that. But as far as the concept goes, it's brand new. I think it just opened like the last year and a half, 2 years, and it's already grabbed some headlines. I know some great folks that haven't been advising it, so
Hmm. Right.
would
Okay.
definitely recommend.
Well, that's really interesting that there are these more effective, more agile options for getting the primary care. I think I can see the hesitancy towards more people adopting that, just because the traditional insurance that you get from your sponsored by your employer, it does give you that peace of mind. Like, should you need the very expensive, uh, unforeseen problem, like
Yeah.
the cancer, the whatever, the car accident.
Mm-hmm. And no, it's gonna, like, again, I don't think a lot of Americans have had that conversation of risk with themselves.
Yeah.
And as a consequence, I think they sometimes is like get allowed to get kind of like convinced or tricked, or just they get really, really nervous and they're just like, I just need this just in case. But for what they're actually like, what I'm saying is, even if that's your main concern, if you're really concerned about the catastrophic kind of scenario, there's a lot more plans out there, like non-traditional and non-traditional forms of coverage that could be way less expensive for you and save you some money in the process, while also ensuring that you get that top level unlikely scenario.
Okay, cool. So I guess like the takeaway here is whether or not you're ready to, forego your employer's healthcare. Maybe you're not there yet, but at least now the takeaway here is now you can research some other options that might be better for you that you didn't even know existed. Is that fair?
Yes, that is
a change of culture towards your coverage.
Yeah, it's just it's kind of like a JG Wentworth. It's like, it's my money, let me use it when I want to, right?
Yeah. Right.
and I just again, like I always tell people, like when we talk about premiums, I've noticed that there's been like an odd change in behavior when I'm like, did you know you could buy like 5 or 6 60-inch Roku for like UHDR like TVs? And they're like, what? And I was like, yeah, or like you could buy a used car like with your
for what
premium.
you're paying.
Yeah, I think sometimes like we've just been kind of allowed to be like, our healthcare is a main concern to us. That's totally rational. That's totally fine. I care about my health as well. It's just that when people actually tease out like the minutia of like how many times are they going to doctors, what are their particular healthcare needs, if they don't really have much, why are you overspending that much? Is it really worth that $7,000, that $8,000, that $6,000 you're spending in premiums every year? That's the question. Yeah.
Right. Yeah. So we're locked into this culture of not questioning overspending.
Right. But I mean, that should concern you, right? Is that you're not the primary payer of your own health insurance. Like, isn't that like, that's such a, like, sorry, you're not the primary payer of your own health cost, I should say.
Yeah.
But think about that. Like, no other industry, no other kind of like, there's like, or at least there's must be a very few, right?
Yeah.
It's where the little consumer of a good and service is not the primary payer of it. It's kind of a weird concept, right? It's like, I mean, it's just, you are not actually having a responsibility for that spending, and therefore you're not the customer, right? Which means that the people providing the care, charging that medical bill, don't care necessarily about your side of it, your influence outside of basic user experience and making sure they have a good standing in the community, right? Like a hospital doesn't really care.
Right. Interesting. It's almost like I was trying to think of something comparable. Like, imagine if the government wanted to be the single payer of your groceries.
Yes, I made a joke about that not too long ago. I was like,
Yeah.
isn't it like I asked somebody the other day, like, why don't you see people going into the streets advocating for a universal chicken nugget system, right? Like, why?
I might advocate that, and I'm as conservative as they come. Just kidding. I don't need chicken nuggets, but it's kind of a fun idea.
Get the vegan option. No, but like, why is that? Why don't most Americans just pick one particular type of service that we all agree that we like or that we need,
Yeah.
and we demand it to be compensated for us, right? And the reason is because in the grocery market, it's ultra competitive. People like you and I, like, we probably sat down, talked about diets, we looked at nutrition, we did like little tiny research, we read the blogs, we watched 2 videos.
I'm all about health. Yeah.
Oh yeah. So like we're actively making decisions based on certain incentives. We're trying to get the best bang for our buck. We're trying to get the best quality food. Like, we're actually engaging in a normal market, right?
Yeah.
And there's tons of people, like competitors and like the actual manufacturers and providers of this food. They're all competing with another. And even like the vendors of this food are creating innovative ways to be in competition with another and to get better rates and prices and to lower, like aside from the manufacturing side of things. And that's what's like, makes your milk only stay at $2.79 or $3, or if you're in Hawaii, unfortunately like $5 or $8, but
the high competition.
But, it does good things, and it's very easy to see in the grocery world.
Right. Interesting. I wonder if food production has a lower barrier to entry. Like, you don't have to go to medical school. You don't have to like get a undergrad degree in medicine and then like have to go to medical school after that, and then maybe a fellowship to specialize. Are there ways that we can is medicine in America so regulated that there's just no freedom to be more entrepreneurial? Because if you want to break in, you have to invest tons and tons of education and tuition and just years of specializing.
Okay, that's a really good question. I'll respond like some of the most informed people I've ever seen on like a healthcare issue are the family members of someone that has a individual with cancer,
Yeah.
right? They know every term, they know all the jargon.
Yeah.
They're not making prognoses or diagnoses, but they're able to respond when they see like a side effect, or they're able to know what is going on actively, and they're able to get the doctor to kind of come on board with them. I mean, like this is the thing. Like, I think like I'm not an MD. I'm not going to pretend I know all the great stuff out there. I'm not saying other people should pretend either, right?
Mm-hmm.
But have you ever gone to the doctor's office and you just felt like you were getting whisked away? Like they like literally just, they said, stick out your tongue, check your ears. You told them your issue and they're like, oh, that's nice. We'll try this thing. You try that thing, it doesn't work. And you literally felt like, even though you waited 55 minutes to get into the office, you just got thrown away.
Yeah.
Right. And then it turns out you have to like get into like this death cycle where you have to visit like 5 other doctors until you get one compassionate one that's actually going to hear you out and get you the care you need. Mm-hmm. Right. And what I'm saying here is that like, that's a space for agency, right? We don't even get the game of like trying to WebMD ourselves or become hypochondriacs.
Right. Yeah.
But like people are just like so uncomfortable even talking about trying to form a reference for understanding medicine as like a non-educated patient, right? But there's plenty of stuff you can do, and it's in your unique interest, right? Like, but I want to talk a second here. Like, think about this. It's like we manage benefits like Ross and 401ks and auto insurance and like stock portfolios. And like you and I have talked about nutrition, like, right? Like no one gets born to this on this planet. It's like going to know all this stuff right out the gate. It's like you have to learn about these things, right? Mm-hmm. And people have shown competency is in very other complicated areas, yet they won't exercise their agency in like health financing when it comes to their insurance, or being like, oh, is this doctor really have my interest? And should I just trust them blindly? Like that's an odd thing to me, where it's like we've shown competency in so many other areas, but for some reason with healthcare, we just allowed ourselves to kind of get into this culture where we let other people make decisions for us.
Yeah.
And, I think people are just kind of scared of being wrong because it is healthcare. But I also point out, like, imagine if you got your stocks wrong. What happens if you go bankrupt? Like what happens, if you're eating a food that had like a carcinogen in it and you didn't realize and you got cancer? Like there's like all these moments where it's like, if you don't pay attention to some other more slightly complicated industry or practice or thing, it has serious consequences. And I'd argue that healthcare has the most consequences, right? And just because it's hard to get the right diagnoses and to like make sure that you're like getting the right treatment plan, it doesn't mean that you should give up agency though. You should be incentivized to care about it so much, right? Which means like the actual maintenance of the medicine you're receiving and treatment, and more importantly, which I said in the very beginning of all this, it's about the financing, because that's the stuff where we can where we could exercise the most control and change stuff up and see good things happen.
Mm-hmm. That's so funny though, that you mentioned about individuals becoming more educated, more aware of these complicated fields. And so many people, they don't put in that research. They don't feel like they're competent enough to make these decisions on their own. And so they're going with the flow. They're kind of acting like sheeple. It's kind of the outliers. It's like Joe Rogan got COVID, but he was willing to take ivermectin, and it turned out it worked well for him. But that was happening when everybody was saying, oh, ivermectin is horse medicine. You can't take it. Mm-hmm. You kind of have to have that disagreeable willingness to embrace risk, I think, to explore these still fringe options. Not fringe is the right word, but they're not mainstream yet.
Yeah.
Because what is mainstream is being dictated by an establishment and the old institutions.
It's funny. I was just talking to some folks about like agency in healthcare. One of the most easiest ways to see the complication here is just talking about vaccines, right? It was kind of funny. I thought like there's a rational group of people sat down together to fire, and then some people are just talking, and they're just like, like you are damned if you do, damned if you don't, right? Like it's it's so polarized in the ways that people react to you when you just talk about vaccine status, right? Because it's like you got people on the alt-right being like, oh no, like you gave in, you let Fauci convince you to get that, so then get the shot. and shame on you. Like, we don't know
You're
that's
not
going
pure
to
blood.
do.
Yeah.
You're not pure blood. You're like, you're not thinking the long-term consequences. Who God knows what's in that.
Yeah.
And then, like, if you don't get it, you're an anathema. You're a bad guy. You're inconsiderate. You aren't thinking about public health. You're a monster. And that's where I will concede a little bit, even though I'm a huge advocate for agency. I understand it does get complicated, right? Is because there's going to be a lot of moments where people are saying that your agency is wrong, right? And like, at the end of the day, like, your personal risk assessment was like, I have elderly people at the time when COVID was the most, like, kind of, we didn't know anything and you got a shot. That made sense. You're like, even if you thought like you might be fine or you didn't know, like, you're like, well, it's too much of a risk. I might be asymptomatic bringing it back home to my grandma. Like, that's fine, right? That was like, you made a personal risk like assessment, and you made a decision, and you assumed like a type of healthcare, right? Like, and that's where it's like, I think people need to have a little bit of backbone there. And I'm not sure like all this, like the dealing with the court of public opinion on these, like sometimes like there's a once in a while you see like a healthcare issue become mainstream and get talked about, polarized, but oftentimes it's not, right? Like when I talk about agency, we're talking about a lot of different scenarios where you navigating the risk of cancer, you figuring out how to get the right nutrition plan, you making sure that the stitches actually were good, right? Like, there's moments where you can exercise agency and it's completely in your interest, and you won't receive public backlash for it.
Exactly. Yeah. I love this idea of kind of being disruptive, being a disruptor in this field. Like, people say, oh, well, are you a doctor? Are you qualified to make these decisions about your own body? It's it's crazy. And it's funny when you mention how, and in your experience, some of the most knowledgeable people about, say, something like a type of cancer or whatever are the family members. It's so funny. I think like the origin of the word amateur is lover of a subject, and we have kind of a stigma against that word. It means like a beginner or a novice who's unqualified yet. They haven't put in the right amount of work or whatever. But I kind of like when people become that. They're amateurs, they're lovers of knowledge of a particular field, and on their own they become autodidactic. They learn on their own. I love it when that happens.
It's why surrender the freedom, right? It's like, why, like, you don't get booed or admonished when like you make a bad decision in a stock. I mean, like, maybe your family might, but like, it's like, I feel like the stigma for making certain decisions or taking agency just doesn't, it seems to like be free everywhere else. But when it comes to like some of these like pockets, like healthcare, that's when people have like a real say, and they're saying like, you patients should have no say in this whatsoever. And I get it. Like, I respect doctors, right? They like put in the time. They put in 12 plus years usually. They have gone through extensive circumstances. They have high experience, lots of clinical hours. Doctors are good people. It's just that there's financing stuff on their end that cause them to act in different ways. They're normal people, right? And I'm saying is that even though they have a heightened sense and skill in a particular area, you can still come out and be your best self advocate in these moments, right? You don't need to pander and give it all away. And just because you hear a very scientific word, or the word out of pocket maximum in your health insurance, doesn't mean you should like freeze, right? This is just like, this thing is here to stay, whether we like it or not. So like, do you want, like, it's like you're trying to avoid going bankrupt, and you're also trying to make sure you get the best care that you could possibly get, right?
Yeah. That actually brings me to my next question about the entrepreneurs, like the solopreneurs out there. There's enormous interest right now in becoming your own boss, about making Wi-Fi money. I think the pandemic actually helped accelerate this, because more people learned that they can work their full-time jobs from home, and now they're learning that they can make additional income from home, and that's opened up a lot of opportunity out there. But if you were to do this entirely as your own source of if you're working for yourself as your primary source of income, you become an entrepreneur, you eventually run into the problem of, okay, I can't rely on an employer for my health care. I need to provide for myself. So what is your advice to those folks?
It's a good question, very pertinent. Although I'm not sure the gig economy is looking good in the future. but
Sure.
we hold faith. We hold the faith. It's no, so that's a great question. And like I would say that like independent folks are really unique is because that entrepreneurial mindset makes them automatically different from the rest of the population, right? Like they literally are taking ownership over different aspects of life. Really, the revenue and income they're bringing and like the trade that they're getting into to get that income is a whole different thing. And they have to manage their own accounts, like their own financing, expenses, overhead, everything, right? So they actually kind of have the aptitude. And like, I think that's a reason why they go into the individual health insurance market is because they're able to get plopped into that market, right? And they're able to navigate it. Like, I think a really good thing, if you're like an independent person, if you haven't heard it before, I think you'll have the chops too, because you have to be considering so much things here. Health insurance is one of those things that costs a lot and you want to mitigate it if possible, while also maintaining best possible avenues to get care you need, is really like kind of like look among different markets, right? There's a lot of different types of health insurance markets, right? It ranges from where you can just type in some basic information in eHealth and just say I'm an individual or I have a family, this circumstance. They ask you like 5 questions and they put in your zip code and you get access to all these different plan structures, like all the 3-letter acronyms like EPOs, HMOs, PPOs, everything. And I think that's a good way because you're going to be able to look at those things and do a side-by-side comparison. And I think like I can trust those folks actually more than others to like be able to, even though like not all of us have the best reference for understanding what our health insurance is doing for us, I feel like these people are able to kind of read between the lines on that. And I just encourage you to like check out the different marketplaces. Also look for, again, as I said, the alternatives, right? Like Crowd Health makes a lot of sense. Taro makes a lot of sense. Direct care models make a lot of sense for you. HSAs really make a lot of sense for you, unless you're in like a hazardous occupation, then maybe you might not want the HSA. But like my point being though, there's a lot more options and you shouldn't feel bad just because you're kind of like going out, you're not sticking to that traditional pathway with the employer and you're trying to do something for yourself. Here is like, there are tools getting built right now. eHealth is a good starting point, but I have noticed, because, like, as you said, Joe Lonsdale founded Cicero. And because of that, I get a cool exposure to all these new startup ideas out there. And I can definitely affirm that there will be some, just as like we see like some Trivagos of healthcare, like GoodRx popping up for pharmaceuticals. I believe we will start seeing, and hopefully like I can be one of those contributors one day, right? Where we see a program that can actually make sense and make recommendations for what type of health insurance that looks at the whole market, right? That looks at the whole market and gives you the best option based on your unique healthcare needs.
Like it performs an assessment of the individual and says, all right, based on these markers, these are your risk factors. Here's how we can insure you for coverage of these. And it's tailored to you individually. Is that about right?
Yeah, and I think we're getting there soon. Right now, we're not. It's kind of sad, is because, like, as I said, it's like I made an argument. I love price transparency, by the way, like knowing what you're actually going to pay for in healthcare, big thing. But I think you and I have seen stats where it's like, just because something is transparent doesn't mean people are going to use it, right? Especially when people never had incentive in the first place to engage with that new information, right? Like hospitals have been required now for like, I think a little over a year to release their prices, but if you do surveys, people will always say they like 94% of people will say they like price transparency, but only 6% can admit to actually having shopped for a shoppable service.
Right. Well, I mean, if you're in the hospital with a broken leg, you probably want to be treated now rather than shop around.
I know. A funny thing though is like I think I saw it was Paragon Health Institute, Brian Blaze, and also HHS put out a report showing that they declared that 46 to 49% of all healthcare services are deemed shoppable, meaning that you can make it within a few months in advance. And there's usually ample opportunity around you because they look at like a census information as well. And that actually, I think it was like some ungodly number, like 67% of all healthcare needs are happening in that 49%.
Okay, that's good.
Like the bulk of care that we need is happening in that. So
yeah.
That's just one thing about shoppable is like there's actually a lot of opportunity there, but again, like we just haven't been really there's been no carrot for us to go into it, right? So I would just say for these independent people, like top level is like read up. Like if you're new to it and you're like just starting out as independent contractors doing something like that, like please understand these 4 nouns that will change your life. It's difference between a premium, a deductible, co-insurance, and out-of-pocket maximum, right? Like, as I said again, I believe it was less than 4% of Americans know all those four terms, what they mean.
Can we go over them real quick?
Yeah, and I was going to say, Christian, do you know those four terms?
Probably 3 out of 4.
Which one do you not know?
What was the last one?
Out-of-pocket maximum.
Okay, let's go over that.
Okay. So let's start from the beginning. So premium, right, is the monthly contribution you give to a third party to cover your health expenses, right?
Yeah, that's what's taken out of your paycheck.
Yeah, that's usually what's taken out of your paycheck. There's some other different ways to do it, but yes, that is the primary way. And so, that's like that number when I said, like, that's usually the average right now with employer-sponsored health insurance is $600 a month for an individual. For families, it's much more. It's like 20, like I think like per year that premium get to like to north of $22,000. That's mind-numbing to me. So that's a premium. Deductible, right? Deductible is the amount of money you are responsible paying out of your own pocket before your health insurance starts to kick in.
Right.
Right. So like usually you'll see like, $400 premium with a $2,000 or $3,000 deductible. Kind of standard, a little bit, not kind of. Right. So you're knowing that like, if it's $400 times that by 12, that's what you're paying. Right. For the whole year. Plus theoretically,
it resets. Yeah.
Yeah, it resets, right? Deductibles reset every other year. So like it's just for one calendar year, like you have this out of pocket that you owe right there. So once you meet your deductible, so say you spend $2,000 out of your own pocket while paying your premium still, you then get into co-insurance. Co-insurance, people who don't understand this, is that it only covers about 75 to 80% of your medical bills. And this is why we still see problems with medical bills, right? Is because the price of healthcare is still really, really high, right? So when you get a surgery, people are like, I'm finally past my deductible. I'm going to be fine. Probably not. If it's $57,000, 20% of that is going to be problematic, right? I think it was like, I've seen crazy numbers that most families don't have $3,000 in disposable savings in their accounts right now. So like, think about that. Like, imagine something crazy happens. You go to the hospital and you're like, I should be fine. I'm in my deductible. This is even with traditional health insurance, right? Like the thing that's supposed to protect you. Right. Like you could be theoretically responsible for 20% of like a medical bill that's $60,000 to $50,000. That's wild to me. Yeah. But anyways, so the idea is that so the difference between co-insurance and out-of-pocket maximum, though, is that as I said, right, you're still paying 20% of your medical bills, right? And that 20% is going to carry over that'll count towards your out-of-pocket until you reach the out-of-pocket maximum, which is like the complete upper ceiling, where you supposedly spent enough money to finally have your insurance cover 100%.
Yeah.
And these things can range. Like usually a deductible can be anywhere from like, to these days, like $3,000 to $5,000 to $8,000, right? But the out-of-pocket maximum can be like, sometimes it's low, sometimes only $2,000 more than your deductible, right? So it's $10,000.
But I mean, if your out-of-pocket maximum is $10,000, I mean, that's a hell of a year to even reach that.
I know, but I mean, people have chronic issues and some people hit it, believe it or not, right? Like
that makes sense. Yeah.
Heartbreaking, right? It's so there's moments like that, but also sometimes though, depending on the plan, it can get really high up there, which makes it a little bit more of a game, right? That means like you're only getting 80% of your your overpriced medical bills negated there. So that's knowing those four terms is all the difference for these independent folks, is because when you're like sitting there and you're looking at the insurance market that you're dipping into because your employer is not offering it for you, right? Like you'll sit down and you'll see like, usually it's like a bunch of options listed in front of you. It'll say like Anthem, PPO, and it'll say the premium amount as terms of a year and then the deductible, right? You're going to want to click on that and open up the extended benefits page. And I want you to look for those words, those four words. That's all you need to look for is co-insurance, out-of-pocket maximum, premium, deductible, right? Is because a lot of times deductibles, if they're lower, means you pay a higher premium, but that also means that your co-pays, your co-insurance, and your out-of-pocket maximum are all subject to change, right? So you just got to make sure, like think through this, like I think I'd recommend for these folks, think it through, right? What are my known risks? What are my actually known healthcare needs right now? And then kind of get an estimate of like, do a conservative and a radical estimate, right? Where it's like, okay, like theoretically, I might spend this much this year, or if these series of things happen, or in worst case scenario, I pay this much. And that will kind of be your North Star for being able to look at co-insurance and out-of-pocket maximum in relation to a premium deductible and making a more meaningful decision to decide if that health insurance plan is best for you from the individual market. Or fun fact is you can look at those and see if a crowd health or someone else is better for you.
Right, right. Now, if you're making estimates on services that you might need, but let's say you've never had them, so you have no price comparison, where can you look up information on what on pricing? Yeah.
Yep. No, that's a fair question. Technically, see, this is hard for me as like a health policy person to like just kind of give this information because I know like the little trickery behind this. So I could tell you right now, like, okay, go on to Turquoise Health or go on to just Google a hospital's website, and they're now required to list their cash prices now, right? There's self-pay options. It's all those terminologies: self-pay, cash option, cash rate, discounted rate, whatever the fun term is. If it's out of your pocket, it's a cash rate. Let's like think of it that way.
Okay.
That's what you're looking for in these scenarios, is a cash rate for a particular type of service. The thing that makes me frustrated with providers and insurance companies is that they throw in these things like called DRG codes and CPT codes. So you might think that, oh yeah, I'm just going to type in the word colonoscopy in the search bar at the hospital's website, or I'm going to look at their Excel sheet and look for a colonoscopy. Sometimes you might not even see that word. Sometimes you actually might see like CPT 45378. So it is still quite difficult to get a, like, looking at 20, like for example, Christian, I kid you not, I did a fun little study where I called over 200 healthcare providers in several different cities to get cash prices. It was a nightmare.
I can imagine. Yeah.
Like it was just, and this is like me pretending to be uninsured looking for a service, right? I'm trying to get a quote over the phone. That was like my main mission.
Right.
And I got to tell you, everyone tried signing me up for like Medicaid, or they tried putting me on some kind of medical credit card with the hospital, or someone, or they would like, I would have to like remind them that I was uninsured, because a lot of times, for example, I was like the theoretical thing, I was looking for a colonoscopy here. And I was like, I remember this one group in Houston, and they were just like, oh yeah, that's going to be $22,000. And then I was like, I'm uninsured. They're like, oh yeah, yeah. And they hear a bunch of clicking, and then all of a sudden they pop out new discounted rates they're like, we'll give you a 91% discount. That's still over $2,000. Like, like that's like, it's actually so hard to get a real accurate assessment, is because the funny thing is I recalled some of those places. The next day, the prices were different. Quote to me over the phone. People don't understand is that healthcare, like those prices are made up. Like there's literally a group of administrators that like have like an ideal made up, like they kind of like start up really, really, really high on purpose, so they can negotiate with insurance companies and government programs, and sometimes uninsured people, sometimes. But like the thing is, like there's so many different types of consumers, or I guess I shouldn't say consumers, payers walking into the door for health insurance, or for health providers. My gosh, I get those words mixed up all the time. And so what that ends up doing is that the hospital is like playing this game of like, I'm going to give a price to these people, and I'm going to give a price to these people, and it's all going to be different, right? It's because they have different leverage in different situations depending on who's paying them, really. So like, for example, the federal government carries the most because they have the biggest risk pool, usually. And they get to say, no, we're not paying you more. Private health insurers, they have to be really, really big to have any sway. Otherwise, the hospital is usually way bigger. They're a regional powerhouse. And they'll just say to the health insurance company, if you don't pay us at this price for this procedure, we'll shoo you away, and your members will have to drive 20 miles to the next hospital, which is not, if you're a good insurance company, you want to make sure that people can access the health system closest to them, right? So complications there. And then if you're an uninsured patient, you probably have the lowest amount of leverage. There's things called financial assistance policies that people can get into, but all this being said, it's really hard to ascertain price. So like you can Google hospital websites, you can go in Turquoise. I guess maybe this what I could say is that some specialists that have a private practice or some primary care docs that are like doing the direct primary care program can be super transparent with you about those things, opposed to like ASCs or like ambulatory surgery centers or hospitals. But it's just going to be a little bit of a game, right? Like, I think that's why I'm still working in policy, right? I'm trying to make sure that we can access the information, but it's not really quite stellar yet. But right, for what it is, we have to work with what we got, and you have to take that assessment, and then you have to kind of reapply. For example, we can talk about insulin, right? Usually insulin is actually, there's a little bit of a fixed rate for it, and you can get a cash price that makes sense. And then you can do that kind of like your own personal actuarial assessment, being like, okay, I have insulin, like I need insulin, right? How much is this going to charge me? Like think that out. Like think through a whole calendar year. How much insulin are you going to consume? Was it per pop? And then put that against not just your premium and your deductible, right? That's the important thing, is like, imagine like all the money you could technically have to be liable for in a given calendar year with your health insurance, and then contrast that with your known healthcare costs. And that will tell you pretty quickly, if you should be getting health insurance or not, or at least you should have an incentive to look around for health insurance.
Right. Well, I'm still reeling from the idea that based on when you give somebody a call, like a colonoscopy could range from 2,000 to 21,000. I mean, it's like student loans have a lot higher education to start charging higher for tuition. It's a distortion.
There was an AEI chart. It's they kind of joked around, or AEI being the American Enterprise Institute. They created a chart, and they created the title graph of the century ? And it showed like general inflation. It showed types of services and goods like that have like which direction they have gone in relation to inflation. Hospital services are 200% above inflation. That's mind numbing. Like it's easier to get a used car or a new car. Like it's like depreciated as far as like the price has gone. But hospital services and college tuition are like the two leading ones, but hospital services beats out college tuition. And the other thing I was going to add there too is like, I've talked to some of these companies that are trying to be like, see, the nice thing though, Christian, too, is like, I said Turquoise Health, that might be people's better option here for getting that price we talked about for making their assessment.
Okay.
Is that like, there's more than just Turquoise Health. There's other groups out there like Healthcare Blue Book, MetaBid, that are kind of popping up. They're functioning as like price transparency companies where they're trying to be the Trivago of healthcare. So they can show you insured or uninsured, like, so cash or insurance money costs, like, as terms of price too, right? So that is coming together for them. And like, I would encourage those folks to use those resources. But that being said, the thing I was going to say about MetaBid was, this is going to scare you. In Tennessee, when I was looking at hip replacements, I saw a 1,600% delta between the lowest cost service for like the exact service, right? It's the CP2 code. And do you know how far away those providers were from each other?
Let's say they're really close.
Couple miles.
Yeah.
So like, isn't that insane? Right?
Imagine like you're the family who has like grandma breaks her hip, and you take her in, and by sheer bad luck, you go to the one that's like 1 mile down the road this way, that's, at the upper end of the delta, instead of the other place. And let's say that ruins the course of her life for the rest of her life because it breaks her bank.
I saw a study that said as people go to the hospital, chances are they're passing several options for an MRI that are way cheaper, like $400, $500 cheaper, right? It's like, that's the one thing I was going to say too. I don't know if we got right into it, but when it comes to surrendering your consumership power to an insurance company, you're giving the ability for someone that's supposed to, like, you're almost like paying them to get you the best deal, right? That's kind of like another way to look at insurance companies. They should be like, since like they're getting the money and they're spending the most money, they should be like the consumer advocate, right? They should be like the patient's advocate. But they're like, I'd say that insurance companies are actually really like a rock and a hard place right now, because there's a thing called the medical loss ratio and narrowing networks. So think about this with me, and I'll try to get through this jargon together. Is like, so there was a rule created in the Affordable Care Act back around 2010, 2008, I forgot exactly. But That said, all private health insurance companies are required. So like whenever they get a premium, so they say they get $1 for every like premium dollar they get, 80 cents of it has to be spent on their members' healthcare claims.
Okay.
And 20% or 20 cents per dollar, right, is saved for the insurance company to pay their employees, advertise, administrative costs, grow as a company, right? And on the surface, this sounds good, right? Like, oh yeah, like those darn insurance companies, they're going to be covering 80% of my health benefits. And if they don't, they're going to have to give me a rebate. So I'm a win for me, patient win-win.
Right.
The problem with that logic, though, is that some of the big insurance companies, they took this regulation on the chin, and they realized how do we make more money? And think about that. What do they think about? They think about, how do we make that 20% more? How do you make 20% of something more? You spend more.
Yeah.
Right. So what ends up happening is that the health insurance company will, like, they'll see some of the, like, even though they, like, for example, like there's a story in New York where this chemistry teacher had arthritis and he was going to one hospital in New York. They were charging him, his insurance, City Health or City Emblem or Emblem Health or something, was getting charged $15,000 per pop for Remicade infusion. He went down the road after his doctor moved to a different hospital, got the same doctor, the same region, same health insurance. He looked at his insurance statements again. That hospital for Remicade was charging him $90,000 per infusion. And the reason that you'll see, like, and he's like, why didn't my health insurance squawk? Well, for one, he was on a city program that complicates it, but even some big private health insurance won't squawk about it. And that's because they know that they spend more. That means they're able to pull more out of the premium dollars, right? They're able to actually have like a higher amount of money for them to do their side of the business, but it also justifies them increasing premiums and deductibles next year, right? And so you kind of have this death cycle where the insurance companies are like, they'll negotiate it down so far so they don't have any too crazy overhead, and they're like kind of doing their accounting right, but they're totally not incentivized to bring down prices, at least when they're bigger. So that's some insurance companies. Again, it's complicated, it's healthcare. So that's some insurance. That's not all insurance companies. That's some of them. The others are stuck having to deal with very powerful hospitals or providers or physician associations, right? So for example, like believe it or not, there are health insurance companies out there that are trying to save costs. The problem is that when they try to save costs, the only thing that they can really do is narrow the network, which means cut out an overpriced provider from the network, which means that if they become out of network to you as a patient, which means that you're on the hook, like it won't, like anything that happens on the out of network right now in the status quo, unless you're traveling, that's like the exception, will not count towards your deductible. You won't get money from like co-insurance, right? That's problematic. Right? And what it does, and what the real harm here, Christian, is that it limits your choices in provider, right? When people narrow their networks, it's kind of saying to the patient, like, even though there's this great hospital with this high-ranked surgeon, their administrators are charging too much money for that service, and we're not going to pay for it. And all of a sudden, you kind of lost access to that person, right? Or at least being able to afford that person.
Yeah. Well, can I just interrupt and say, it sounds like the insurance company at least is acting in your best interest, but it has a regrettable consequence. Does that behavior on the part of these, let's say, more virtuous insurance companies, does that incentivize the healthcare providers to shape up and be more efficient?
No, because again, as I said, like, understand that like about 90 million people are on Medicaid right now. Medicare is pretty high up there. I want to say between 60, 70, right? But anyways, like we're looking at a number around 150 million people, right? That's a giant risk pool. Right. And like that's real consumer power, right? Like that's why the feds and state programs can look at hospitals and be like, I am paying you 60 cents to the dollar. You live with it. That's but this is what happens. The hospitals are so big, they've consolidated so much. They know that they can go into the community, dominate it all, buy up all the positions, build more real estate, become like these little hubs, become staples of the community, provides a little bit of like charity here and there, look really good PR, build the grant, Arizona Children's building the the granite salmon water fountain in their lobby, like just really weird, unusual things, but they grow in power. And the reason they do that, and you notice that there's not a lot of like chains outside of a state for a hospital, is because it's all cartel regional game stuff. They're trying to become the biggest fish in town. So when these private insurance companies come to them with a smaller risk pool, which means less consumer power, the hospital gets to say, as I told you earlier, like, you can meet me at this price or you can take a hike. And the insurance companies have their hands completely tied, right? A lot of the time, where it's like either they pander or they try to be noble or they try to be cost savvy, but it's at the detriment to where now that person has to travel 30 miles to a person they can actually access, right? Mm-hmm. That's the problem here. And so again, the insurance companies and hospitals have been in a war with each other for a while now. I say hospitals are winning these days. So it's just a hard spot. So even for like, it's kind of crazy, right? Like, as I said, you're not the primary payer of your own healthcare, even though you're the primary consumer, and the person you're surrendering most people surrender their consumer power to, it's kind of just has some rough odds, and then has the deck stacked against them. And I'm not trying to be super over sympathetic to the insurance companies, but I do recognize economically that sometimes they're put into really hard places.
Okay. All right. So let's talk right now to the person who is, let's say, the millennial who gets insurance through their work, health insurance coverage through their employer. What can they do right now, like after they stop listening to this YouTube video or podcast? What steps can they take to bring that consumer power back into their own hands?
Yeah. So I'll probably confuse, because I've had some thoughts about this for a while now. Mm-hmm. So I'll kind of say, start out by having an honest conversation with yourself and just ask some basic questions. Like, one, again, like, what am I actually scared of? What does risk actually mean to me? Mm-hmm. What am I expecting my healthcare to pay for? That one's so important. Like, are you envisioning it covering for catastrophic stuff? Are you envisioning it paying for your prescriptions? Are you envisioning it paying it for like chemo? What do you see your health insurance actually helping you with? Because that will put into perspective for you how much you actually need them, or at least that type of plan, or like that concept you need, right? And then I'd probably say after that is like, what are my known healthcare needs? Like, as we said, doing that assessment, think about the account of things. What's likely to happen to me? Factor in the genetic disorders, factor in like propensities, factor in some of that stuff, but also be like, don't be hypochondriac either though. Like, sit there and be like, for like the last 4 years, I've maintained my diet and exercise, and I've gone to the doctor only twice, not because I don't like doctors, just because I haven't had a need to, right? Yeah. Don't feel pressure. There's, again, as I said, there's the HSAs, there's the crowd health, you can go into the individual market. There's something out there, right? So just always keep that in mind. Just like, don't automatically feel super pressured just to take a health insurance plan because your employer is offering it, right? Remember, it's portable. You're only getting an illusion of choice. There's more out there. And if you ask yourself those questions, it will help you discern which plan makes the most sense for you. Outside of that, Christian, I've actually had the fun job of helping my friends. I've helped 27 people now pick their health insurance with their employer. And these are just some faux pas, some patterns I've noticed that I think would be pertinent right here.
Let's hear them.
Yeah. So one, as I said, learn the 4 nouns: deductibles, coinsurance, out-of-pocket maximum premiums. 2, please do not mistake a flex savings account as a health savings account. I understand healthcare. There's too much jargon. There's too many acronyms. I get it. I hate it. But this is an important one because this is usually what's getting offered whenever you hear an SA, right? Like, that's a savings account. Mm-hmm. So the FSA, or the flex savings accounts, is very different from a health savings account, right? One is a flex savings account, is where you get a savings account where you can put part of your wage tax-free into an account, which sounds great. And you get to pull that money for particular healthcare items. Like, I think you can go onto Amazon right now and you can even see that they've been releasing some new medicine stuff and like healthcare items, and that says they'll like show you that this is flex savings account compatible, right? So that sounds cool. Like, oh, just, I maybe like this is the way the taxes pan out, I'll be able to see some of my money that I'm not getting as a disposable income for my wage can go into like this healthcare thing, and I can use it to pay for stuff. That's great. That sounds great. The problem is that people don't realize this is that flex savings accounts, if you say you put $2,000 into it, if you don't spend $2,000, let's say you spend $800, $1,200 goes back to your employer. You don't keep it. It doesn't follow with you. It doesn't maintain it. If you're like thinking about, should I have some type of healthcare savings accounts? Please get an HSA, a health savings account. That's just like, I'm surprising how much that's like come up. Where people are like, wait, I'm losing. Why don't I keep my money? And I'm like, they're not the same thing at all. There's also another thing called a health reimbursement account, which is different. It's not a savings account. It's like you just spend it and you get money back to you.
I mean, what is the advantage of a flex savings account over an HSA? Like, why does it exist?
Well, I think of it like, it's kind of cool with like a 401k, right? Is because you can theoretically, the dollars that are supposed to be compensated, like they're going towards your general compensation, can be put towards your 401k, but make your wage not look different, right? Because it's not being taxed as it's going in from your employer. There's usually a matching as well. And believe it or not, there's some health savings accounts out there that have matching programs as well. Health savings accounts are cool because you get the ability to save money over time, which is just a good practice financially speaking. Two is that you can actually take this money and invest in it. That's why I think some folks on the left of the aisle have accused it of being like kind of like a new form for rich people to maintain wealth kind of thing. But
The
actually,
flex accounts.
Yeah, but no, it's health savings accounts.
Oh, I see. Okay.
Yeah, sorry. Flex savings accounts, you can't invest them, by the way. That's just health savings accounts.
Okay.
Yeah, and so we're talking like, but I'm trying to tell you why like these health savings accounts are great. So tax-free money, you won't see a change in your wage. That's really cool. You can invest with it, and it does have a cap. I think usually around $6,000 per year. But you let that build over time, and there's a point where you can actually pull it out for retirement if you didn't have anything critical. And then also, right, is like you're allowed to use that money to cover your deductible. That's another important thing here is like you can take, so you're literally setting money aside, and usually HSAs or health savings accounts, they get paired with a high deductible plan, right? So you might have like an $8,000, $10,000 deductible, but at least like for all the money you have in your account, you can use that towards your deductible so you can get a step closer to having health insurance kick in for you.
Yeah, that's good. That's what I have. I have a debit card for my HSA.
Yeah, let's go.
Yeah, and it just makes a lot of sense. Super convenient. Okay, what are some other faux pas? Did you have others?
Yeah, so don't get the lowest deductible. It always isn't it's not always the best thing for you, right? As I said earlier, like depending on how those four nouns we talked about play with one another can dictate things like copay, can put you in like a crazy situation where you are actually have a really high out-of-pocket maximum, and you might realize, oh crap, I have chronic conditions and I'm owing 20% for really expensive procedures. Like think that stuff through, and just because you see like your employer saying, hey, it's a $0 or $500 deductible, don't jump on it. Think about it. Compare it with the four other plans you have with your employer. Like just think it through and take pause there. That's one thing I'll say. But if you notice it's okay, the copays are low, I'm not going to admonish you for wanting to be like for trying to mitigate your own out-of-pocket costs and getting healthcare coverage. But the other thing I will say though, this is like the thing that's kind of rubbed me the wrong way. It was actually, I've asked for some change in my last employer because of it. Not like change like the way that we did benefits, because people don't understand is like when I said that number, that the average amount for premiums spent by an individual is $7,739. Your employer per head is usually paying, I think the average is $14,000. So $21,000 being spent on premiums. And usually the high premium plans come attached with low deductibles, right? And also it's like every time you kind of make your insurance company spend money, right? So that's because theoretically with low deductible, you can hit it really quickly, get into co-insurance. That all of a sudden, it's like every time your insurance company puts money down, they have another reason to increase your premium next year. So just because you see low deductible doesn't mean okay. Like just try to like think about what's doable. Like as I said, when you're doing that year-long assessment, ask yourself how much money, like like what's the advice when you go into the stock market? Only put in what you're willing to lose. Think about it that way a little bit here. Like what are you willing to lose for this health insurance?
That's great advice. Think of it like you're investing your extra money. Yeah.
Yep. Past that, please check if your plan requires prior authorization for the things you need.
Okay,
There's
yeah. Like if you
usually
know
there's
if you're on a medication, for example.
Yep. Yep. And then I'd say the companion thing to that is also, oh yeah, for the folks, prior authorization is where you have to get your health insurance company's permission to actually have them pay for a service. Like they need a provider's note or proof or claim showing that some doctor they trust, the health insurance company trust, is deeming that you need this. And they'll give you the green lights, hopefully, and then they will pay for it. Otherwise, you're not able to give the service, or the doctor sometimes might refuse because they're not getting paid. Obviously, EMTALA and all those emergency situations don't apply here. But for just keep that in mind is that like there's some times where like your insurance company who has there's no MDs on staff usually, no doctors, gets to say what you need and what you don't need. So just watch out for them. The market for it varies greatly. Some insurance companies are very liberal. They really don't have a lot of prior auths, while there's some out there that are like, everything is a fight. So just read in between the fine lines. Usually there's robust benefit explanations. So whenever you get your cute little 4-option plans and you click on the windows, there's usually like a little blue link somewhere at the bottom that you can open, and it goes extensively. Just Control F, prior auth. That'll save you a lot of time. Also check if your plan has a cap as well. Some people have like types of specialists they can see as a cap in a given calendar year, types of medications, types of treatments have caps. So if you need something more than 12 times, think about that. Think about that. Like, because you're going to be stuck, and then all of a sudden you're like, oh, I thought my health insurance was good, and why am I on the hook for this? Even though like, I don't understand why it's going towards my deductible. And it's like, well, you didn't read the tiny little fine print. And I know that sucks to say, but it's really important. Like, pay attention to that. Probably the last thing is just do a quick Google search, or if there's an option to kind of pre-check an insurance company's network before you sign up. That's really important. For example, like Kaiser Permanente, right? HMO, Health Maintenance Organization, was what that means. They have pretty narrow networks, even though they're a bigger type of provider / insurance company. They're like a fusion. They're a little weird, but they have like in the country, they kind of are just on the coast. There's very few throughout the Midwest. So be cognizant of that, right? Like if you probably don't want Kaiser if you're going to move out to the Midwest or Central United States. So, and also even within your city, like depending on if you pick like an Anthem, a Blue Shield, Blue Cross, a Cigna, like they carry different networks and they have different doctors in those networks, right? So make sure you're checking so that, for one, if you've been seeing a doctor for all your life and you love them, that you stay with them and at least you can pay them. So make sure that doctor's in the network, but also check out for specialists too. Like check if they have like a variation of good specialists that have like, and usually there's a lot of like doctor rating places that patient advocacy groups do, or other types of organizations do, where you can see like the user experience with that doctor as well. So just do like a soft little Google search, just like, it doesn't have to be anything crazy. Just like look at your plans that are option, just type in those names and just like type in like, what is the network? And then hopefully you'll be able to get connected to some hyperlink that has a map showing you those places.
There needs to be a tool. Maybe this is something Cicero can do, but like a web application where you type in your risk factors or things like that, and it runs you through that process that you just explained.
No, Christian, I have this great concept called FaciliCare. I'm hoping to get off the ground sometime soon, but I'm trying to do that. Like, right, we need an organization. Even if it's not me, it's somebody else. We need an organization that is making these recommendations and doing this work for some people, right? Because I know that like what I'm saying is countercultural when it's terms of like taking agency, thinking about health insurance, willing to learn more. I know American people. Okay, like I get that like we don't have time. We don't want to go through the hassle. There's no incentive here, even though it costs you a lot of money. So I would challenge that. But like, I get that. So my alternative is like that. Yes, we should be involved, but we also need people to help us be involved, right? We need like, there is a demand. There could be a market for these connectors in health insurance to do this work for us.
What's the name of your idea again?
It's called FaciliCare.
Do you have anything written up, like a proposal ready, or?
Oh gosh, I've been going through the whole kind of process and talking. Like I've been doing my market research and getting people. I've been sitting down with some other people that have made startups. Part of the game is like I think that it's been good to know that employers also like want help to pick health insurance, because usually it's a huge overhead cost for them. And I'm also just trying to go through the process of getting a computer designer person to get some prototypes going, and then it's a fun thing right now.
Well, if there's any investors out there listening, shoot me a message and I'll connect you to Tanner, because it's the type of thing we needed yesterday. I so all right, we are recording this at the end of January. I've already started looking at doing my taxes, which is what everybody loves to do. But fortunately, I do use TurboTax, and this isn't I'm not shilling for TurboTax, but it is kind of good to have a good web tool that you have to kind of make sense of this process. And it takes you step by step. And I wonder how hard it was to create this software. Like what you have to know the entire lay of the land. You have to be well versed in what the IRS does, what the rules are. And you consider every possibility that a taxpayer in the United States might encounter in a given tax year. You kind of funnel that all into these steps. It's like a decision tree. Or remember like reading like choose your own adventure stories as a kid. It's kind of like that, except for the boringest adventure possible, paying your taxes. But I'm just thinking of like what type of work goes into tools like that. So it sounds like a monumental task, but necessary.
Well, you'd be surprised. Like I think you just have to make sure the metrics you're using are reliable, and like kind of like if you get a score and you're like, oh, we need to do this action because of that score that lines up. But like really just asking basic stuff. Like for example, like me asking those questions I told you to ask yourself earlier, right? Like that can be codified in the process, and depending on what they say, like there is a very easy avenue to be able to pair them with a health insurance plan that matches them. The problem right now, I think that a lot of these groups that are offering these markets that are missing is that they just haven't stepped quite into the recommendation space well yet. And if they do, they're only getting like they're contracted, or they have some kind of formulary where they're giving better deals for exposure to certain health insurance companies. So like I'm looking to create something that like looks at a whole landscape. I ask you some very important questions. It could be a very simple survey. I look at those. I know what your healthcare needs are. I have understanding of your risk. I have understanding of like what you want your health insurance to pay for. And then I find you the most bang for your buck while getting you the best coverage, right? That's like, I have a vision of creating an individual tool for like you, like just actually like a kind of like a free turbo tax kind of ability just to go on and file your own taxes. But then also I think more of like a premium package for employers. And that's to help them like do like, because again, it's like I said, right in the very beginning of this conversation, that I never had an employer like do an intake of, there might be some legality issues there, but that stuff is getting worked out. But as long as it's de-identified and you're able to ask certain soft questions, like to get like a kind of a snapshot of not necessarily health issues that person has, but health needs, right? That's the important thing. And that can help you get the best coverage model for a large group of people. And sometimes like with very conflicting health needs, right? That's the other part of this. And I think like the next real innovation is getting into the recommendation space, not just for healthcare services, but for payers, right? Insurance.
All right. We've covered a lot of ground, which is awesome.
So much.
If you still have a little juice left, I kind of want to switch gears real quickly, because I was very intrigued by some of your undergraduate research and attention and daydreaming. And the reason I want to ask you about this is I've been really interested in Andrew Huberman's podcast recently. He's a I don't even, his exact title escapes me, but he's a researcher,
psychologist.
Psychologist. Okay. But he does a lot of great interviews and also just videos on YouTube about how you can optimize your focus, your attention, your productivity. And so when I saw that you researched how people pay attention, I thought that was really interesting. So, I mean, let me just ask you, how do you apply some of those lessons to your life? Because you're a high performing individual. Like what are some tips and tricks for the rest of us?
You're too kind. That's a really good question. Because I mean, the real thing that I've learned about in cognition is that it's very easy for us to slip into maladaptive thought processes, right? Like where whether it be procrastination, whether it be like fearing something and like exhibiting a certain type of behavior because you just don't know how to deal with it point blank. Like there's a lot of things like on a very neural level where we can measure it to just like a more social and like kind of high functioning level and like kind of like the frontal cortex area. That's really precious, right? But as far as strategies I employed, it really took boxing. Really, it's like time management stuff. Like this is the kind of thing where it's like I feel like only like the entrepreneur people love talking about because it requires a little bit of discipline, right?
Yeah.
But one thing that served me really well is that like, dude, I can't like working in Cicero. It's like we're talking about price transparency, health insurance company, hospitals. We're talking about pharmaceuticals, electronic health information. We're working in multiple states. There's a lot of stuff that pulls me everywhere, and it's very easy to get lost. It's very easy to lose priority. And so something that you have to do is like box it out, like dedicate that 30 minutes, 15 minutes, 20 minutes, hour, whatever it is, hammer it out as much as you can. If you don't get it, that's the draft that you pick up the next day. But the thing that you can't lose sight of is you need some kind of like framework to make sure that you're always accomplishing micro growth. So the real threat here is that you get overwhelmed, you procrastinate, or you're missing something or you forget something, right? At least as long as you're having gradual growth and you're gradually hitting all the stuff you need to hit in a given day, that's like the real determiner of success as far as like focus and career lineup for me. So like that, the boxing technique has helped out a lot. There's it's kind of funny. It's caught onto my Instagram feed recently. So
The
I
boxing
like,
technique.
yeah, the boxing technique. It's kind of silly. It's been hyped up. It's a little mainstream now. But like I remember like when I was talking to my research professors over in George Fox, and they were just like, try this. This might really work for you. One thing, this is just more like this is like kind of like this is we're getting almost into the therapy world here. Me, one thing that's really helped me is life happens, man. A lot of stuff distracts you. There's a lot of emotions involved, and when you have a high workload, it makes it all the more difficult. One thing that's been good is like instead of I feel like there's like an impulse in today's like popular culture just to kind of be like justify and always affirming our feelings and saying that like everything that like anything that happens to me my reaction is justified. I understand that. I get where the narrative and rhetorics come from. I don't see it as pragmatic for me personally. Where I think that the thing that's like helped out is by just like asking a close friend, colleague, mentor, saying like this thing happened, and I don't know if I'm feeling is fair. Can you talk about it, right? Like kind of like you can physiologically be like spurred on by your emotions, but just actually being able to have that 1 ounce of grace for yourself and remove yourself from a second and just like kind of talk about like, is this worth it? Is this justified? And then if it is worth it, like how do you go about it, right? And I think like a lot of people just do all this internalized, and I just externalized it, and that's just helped navigate and maintain my focus despite like life circumstances happening all the time, right? So like the pragmatic technique here, boxing. The other thing is like really find a person or two and like don't talk about like the drama or the semantics of the social thing making you feel something, but talk about your reaction to it and the merit of it, the value of it, what it says, what it's doing. Is it a distraction? Is it on point? How do you follow up on it? That sometimes just like alleviates and gets all the clutter, like additional clutter outside of a busy work life, right? Out the way. And it's also probably just healthy because you're talking about things.
Yeah. Way more healthy. That's so funny because talking about your reaction to, let's say, an emotional stimuli. It reminds me of Viktor Frankl, the psychoanalyst, who he developed a school of psychoanalysts that he called logotherapy, and that's one of the lines in his book, Man's Search for Meaning, is between an emotional response and your reaction, there is actually space where you can pause and think. And most of us, I think, don't live in that space. I think if you're leading the unexamined life, you're going from stimuli to reaction instantly. And I think the gift of philosophy is, or even like living on a higher cognitive plane is to create that space and learn to react. No, not learn to react. Learn to decide how you react.
Yes.
Yeah.
Yes. I mean, really, you can't control everything that happens in life. The only thing you have power over is your response. Very cliche, but very true, right?
Yeah.
And I think the thing that helps you believe in that statement and believe in that cliche is like something like logos therapy, because it's like you're teasing out the logic of it, right? And I'm not like trying to be like a stoic man that's like, forget your emotions, you can't trust them. No, it's more like, I think that we've just pendulum swung, you know, when everyone kept themselves together in the 60s and didn't talk about their very obvious issues.
Yeah.
And we're now to the place where it's like everyone needs a therapist. And it's like, okay, that wasn't the exact reaction that we need to go for. Like there's actually a world where it's okay. It's like, I think it's good that we've like learned to give affirmation to our feelings, but not like, there's still like a little bit of me that's like, not all of it needs, like it's not absolute, it's not truth, right? Like for example, with like I think the one thing I point out to my friends a long time ago that were like very pro therapy with me, and I like therapists too. I don't have a problem with them. I just like, I think I've known when to employ them in my life a little bit better. I just don't needlessly kind of ride their coattails. But there's like the famous, I think it's the Stanford Bridge experiment, where long story short, don't quote me on Stanford, but like there was a study done where there was this gal that apparently went through some attractive score that had a reliability metric attached to it. And she sat at the end of a corner, and it was over like a flat bridge, and a bunch of guys walked through, and she would offer their number, like she would offer her number to them, and they would measure, the variable here was callback time. And the callback time in this situation was usually 4 days to a week.
Okay.
And what they did was they took, so they got a large sample size. They waited on the bridge all day, and she would approach different people and do this. They took this and they went over to a suspension bridge. So maybe this is Stanford because this is like in the California area.
Yeah.
And I think they went over to the Redwood. I think in the Redwood Forest, there's a suspension bridge. They went over that suspension bridge, and they got the same number of people. So at least the sample sizes are a little bit congruent there. And when she gave the men that crossed the bridge her number, they would call her back in less than 24 hours.
Why would a suspension bridge affect that?
So this is a thing where like what they kind of showed is that like when it comes to romance, getting butterflies and like feelings that we like talk about, feeling love or attraction, right? It's actually right next to our fear response, like in our brain, which means that like what the study was trying to show is that like physiologically we were getting stimulated, some men were getting stimulated walking over the bridge and feeling anxious or just like heightened aware or getting a little stressed out, sometimes on a very unconscious level, just because it's like technically a more dangerous situation. Or maybe it's like an adrenaline rush, maybe it's a pretty view. There's a lot, like it's not for sure exactly, but like, you know, there's a difference between walking a suspension bridge versus a flat road, right?
Yeah.
And the idea was that these men who were most likely getting prompted to ask, like physiologically stressed out or like fearful, and like that aligns, all of a sudden associate the circumstance of having this woman approach them and thinking that fear was about butterflies for her or like having feelings for her. And like, that's my point. We misattribute emotions all the time, what they actually mean, what's actually causing them. There's a real fine line where like the unconscious physiological part of our bodies, where we're just reacting to our environment, meets our conscious part. And with the conscious part, we're always trying to make sense of the physiological, right? And I just saw us say, like, we're humans and we make errors all the time, right? Like, just because we feel something doesn't mean it's normal, doesn't mean it's always right. That is what I'm trying to say, is like, it could actually be erroneous. And I mean, like, not erroneous where like the majority culture says you're wrong, but like for probably in your own framework, you thought it was one way, but it's actually most likely another way that you're reaching these feelings. So that's just like a fun thing when it comes to this conversation about emotion. I like looping in, is that like people do misattribute all the time.
Yeah. Interesting. It's, you sometimes can't trust yourself, and therefore your first initial gut reaction might not be the most helpful way to respond to a certain situation.
Trust no one.
Trust no one, least of all yourself.
But one little tip I want to say about kind of like focusing.
Yeah.
Was really just do like a Psych 101 kind of like Phenomenons course. And there'll be some interesting, because like I did this. I used to work with participants of studies, and I'd administer a digispan task where I would give them a series of numbers and they're supposed to repeat it to me. And this was a essence, a measure of a thing called the serial position effect, where people tend to only remember the first and last thing in a list. They don't really remember the middle. And why that's kind of helpful is like, if you know some of the psychological jargon or just cognitive phenomenon, it lets you kind of be aware of blind spots, like in your attention. Like, for example, if you actually took the time to be like, how long is like implicit memory last? How long is short-term memory? How long is long-term memory? Right? Knowing the subtle differences there could actually help you key in and be like, oh, this is a moment where I might not be figuring it out. Right? And there's even some other cool kind of studies that show like writing, right? Putting pen to paper and actually like writing something is a way better way to help you remember something opposed to typing into a computer. Right?
I've heard that. Yeah.
So there's a lot of little strategies that you can pull to make a grander study or focus strategy. I just say boxing because it's the simplest one without too much.
What exactly? So I am out of the loop apparently. So what is the boxing strategy?
There's a few different. I think they actually created applications now for it on an app store, but it's like you identify tasks and I think you rank their intensity and importance. And there's usually a program now that will set time intervals for you to do it, and you have to hardline stick to that time interval. And the cool thing is that in between these these boxes, there's breaks, right? And like, and the science is that like, because realistically, I think I've been starting to realize that some people can only really work productively hard for 35 minutes before they need like a 2-minute break or 3-minute pause.
Yeah.
Like
no, I now that you describe it, I've actually used apps like that back when I was doing my master's program and I needed a little boost to stay on track.
Did you find success with it, or?
I did, yeah. I think my intervals were about like it was like 40 minutes, 5-minute break, 40 minutes, 5-minute break, 40 minutes, and then like 20-minute break, something like that. And then you repeat it.
Yeah, and it's oh man, like it's so funny. I wish I could give you like this very special trick, but it really just comes down to I just happen to find something I like paying attention to for work. That was one thing that really worked to my benefit. The rest of it was just like doing my job well, making sure I had maintenance over it. And so that's when I started employing an actual strategy like the boxing or some other stuff I've done before. It's kind of funny. I still do to this day. I still write down everything. Like, it's so funny. Like, I really I can't remember anything I put into MS Word or Google Docs, but like I can remember that one obscure little scribble I made in the corner of a page that's like sitting in the back of my desk here. Like, it's just it just does something else. And so kind of figuring out if there's like any of those little strategies you can employ could make a difference, but you have to test them out and you just have to know about them and learn about them.
Yeah. I recently listened to an audiobook version of Stephen Pressfield's book, The War of Art, which was excellent. It was exactly what I needed to hear. He is a screenplay writer and he had a lot of ups and downs in his career. He realized that he was failing a lot. He wasn't producing good enough work because he hadn't reached the point in his life yet where he could just sit down, buckle down, and really do deep work. Perhaps in the productivity world, you've heard like work versus deep work, where you're completely dialed in. And his book talks about resistance, this force that prevents you from sitting down and paying attention. It's what makes you want to procrastinate. It's what makes you want to get up and get a glass of water or check social media or do anything other than the task that you know you have to do. And he personifies this as an adversary who's preventing you from reaching your fullest potential. And I thought it was so helpful.
No, I like thinking about it that way, and just realizing that procrastination at times can be the enemy. Sometimes I see procrastination in the moment to actually be like your body saying give a break, but oftentimes I'd say I align with what you're talking about, where it's very much an adversary.
It's an adversary. Yeah, I mean that's another kind of like cultural cliche, like trust your body. Maybe if you're like putting in the type of work that like David Goggins can do. He's like, I think he talks about the 80% rule. Like if you think like you've reached your limit, you've probably only done like 80% of your like maximum effort or
Yeah. No, I totally agree with that. Focus, man. I just, when it comes to work and trying to talk about procrastination, I feel that it's more of just about escapism, like really.
yeah.
Like I think that people get so scared of failing a task. It's almost like it's what, like, how's that saying go here? It's like it's better to ask for forgiveness instead of permission, right? Almost like it's better to do the bad thing and just like to walk away feeling like, oh, like it just passed. I didn't have to be on the hook where I was subjected to judgment or a possible outcome. And I
Yeah.
just let things slip out of my hands. It's out of my control. It's almost like when it comes, like when I think about procrastination, I feel like it's just this very implicit, sometimes conscious, but mostly implicit way to lose control, right? Like people always talk about wanting choice and agency in America, but when we get it, it's very nerve wracking because like when you're on the hook and you're actually making choices, you can fail
Yeah.
and you'll be responsible. And I think there's just been a reluctance now. And I think we've been like seeing this pandering back to the affirmation of reaction and escapism. And I get why it's happening. I'm just saying it's probably not in your best interest, right? And I think it's like when you have that urge to get 5 glasses of water as you stare at an empty page you're supposed to write, you should probably ask yourself,
Yeah.
do I really need the water? Or am I just scared because that editor is going to say something mean to me about it, or he might not take he or she might not take it, right? That's like, again, like I can only emphasize, have more honest conversations with yourself.
Yeah. Yeah. It's that fear of stepping into the arena.
For people like, I feel like a lot of people this day, especially like your age group, my age group, like they pretend to be so introspective.
Yeah.
Like it seems like it's a farce when it's just like, I feel like if we get down to like measurable outcomes, right? If we look at like time, like dispensing of time and like efforts, we see some really hypocritical or funny or like paradoxical things. And like, look, and I'm not without sin. I can't cast any stones, but like, I just think like if you start thinking about these things for yourself,
Mhm.
it puts you ahead of the game.
Yep. Kind of goes back to leading the examined life.
Yeah.
Just have like the courage to say, okay, I am not measuring up by my own standards, but how can I maybe do a little bit better now that I know that I'm not as good as I thought perhaps yesterday I that I was.
I I mean, I'm a huge fan of like, I think a person should always have like a vision or a goal, right?
Yeah.
And it's more about dream and vision for me. It's like have a trajectory, right? But people always sometimes conflate vision and goal to me, right? Like a goal should be a series of things that you're setting out to accomplish, usually on a daily or weekly fashion, right? The vision is like the arc where you like it's kind of like the promised land you're kind of striving for, is where goals to me are like just a series of like stepping stones that you can take at a very micro level to get one step closer. And it's kind of funny. Just like I've seen a lot of funny stuff on Instagram where people are just reacting poorly to working out, but it
Mm.
almost has like a much more metaphysical tell, right? Because to me, like me and my buddy always go back and forth on this. Is that like people just loathe the concept of working out, like just counting your macros and working out a certain express way and focusing on certain muscle groups you want to see development and over a length of time. And it's all about the consistency of doing those things. Like literally how many times, like, are you improving the lifts? Are you showing up? Are you doing that stuff? And there's just such a current revulsion of that, right? Like you're seeing people like talk about working out if it's like it's fat poic or it's something else, right? I think it's not, and we don't even get into the politics or the drama of that conversation, but it's really telling. I think that people are just upset because they want gratification. They want immediate success. They want
Mm.
these things to happen quickly when the tried and true method of just staying consistent and setting micro goals and making sure, like when I say like you need to create rational goals, I'm not saying that like you're terrible at something, be more realistic. I'm saying like, no, you need to be rational so you can get as close as you possibly can to that vision, right? And that's why like you
Yeah.
set these goals on a day-to-day basis. And that's like, I mean, seriously, I have my little paper check mark, and sometimes I do it on a Basecamp here on my computer, but I just chip away, right? And also that's another cognitive task I forgot to say that helps is like when you actually create that checklist and you hit them off,
Yeah.
it builds momentum for you on your focus.
Yeah.
So
It's so important to have those little goals that you can get that gratification of ticking the box. I'm actually in the middle of a Jordan Peterson podcast, and he's interviewed his name is John Vervaeke, who is a associate professor in cognitive psychology and cognitive science at the University of Toronto. I only began it, but they mentioned this interesting concept of, like you said, you need this kind of larger vision in your life, but you need these short-term goals because when you're pursuing your vision, you are pushing back against entropy, the forces that's going to wear you down, and it kind of spend your energy, I suppose. Like it's like you have a half-life and the ticker is counting down unless you're pushing against it. But what an interval does, what he defines an interval as, the magnitude of entropy between taking an action and its result. So if you have a smaller interval, there's like less of a chance for you to be overwhelmed by entropy. So you're essentially, it's you get more neuro rewards by achieving those small little incremental tasks than you were to like try to accomplish something huge that would take like years to accomplish anyways, because you'll lose track, or you won't get that reward system activating properly, and you'll give up because of entropy.
Yeah, no, seriously, Rome was not built in a day, right? Like it took stone by stone, concept by concept, culture by culture, like this like, like the old style, cool, like civilization we look to, right? That whole project, that whole entity being, that vision came together over a wide swath of time. And I mean, like, look, it's like you can be ambition, and sometimes you'll even surprise yourself in your daily goals. It's just like, think about whenever you see a vision, you need to dissect it into parts in a way, right? Like, and identify what are those parts are, and how can I like translate that into a goal to go pursue it. I think some people, this is like a funny little anecdote, I guess, that might have a little bit of relevance here. I think that people just don't do that. They don't take the time to, for one, set that vision or dissect it or rationalize properly, is because like, I'll go back to the fear thing here. And it becomes like, I think people are so scared of going for broke and having not being able to see how they're doing in the process, right? I feel like people almost are fine with failing if they know they got far, opposed to just failing without having any reference for place in mind. For example, like I remember when I was summiting mountains over in the Cascades, it was so funny. I did like Adams and Mount Hood, that's in Oregon, really bigger mountains, crushed them a couple hours. Like me and my buddy were like doing the annoying running thing, like jogging up in them there while everyone's like with their backpacks. People like hating us. They're like, why don't you be normal? And it's like, okay, we're just going to do this.
Yeah.
And those are way longer, super like difficult, steep, like just exhausting. But it was like, I was able to see where I was in the race, right? I could really see like a place of reference. I know what was going on. I was able to proportion that out to my effort. The time that something becomes so hard in life was actually, I went to St. Helens, which is much shorter. And I didn't check the weather well. A blizzard rolled through, or like just a lot of like cloud coverage. And even though it's a way shorter trail, it took us way longer to get to the summit, and it felt way more exhausting than actually climbing some other bigger mountains, right? And why was that? Is because I didn't know where the heck I was on the trail. I was burning so much energy, putting up with all these annoying cold and stuff in my face, and I was just trying to climb up this mountain. The thing that was driving me crazy, and it turned out, I realized it later, was that I just was so upset with the whole experience because I didn't know where I was. I didn't know, like, I was burning so much. I knew I was burning effort. I know I was trying super hard, but I had no reference to gauge like how much more is left, right? That's what people want. And it's almost heartbreaking in a way. It's like, I had to learn that like a lot of these times, like these greater ambitions that we pursue, right? There is no definitive finish line, right? There is no way for you to like, cause like, I think growth, especially for my world in policy, is super nonlinear. One moment you can be an intern, next moment you're a chief of staff at a governor's office, or you're working under like as an agency, maybe you're running as a politician. Like you're just doing so many different things, and it can like change in the span of less than a year or a couple months, right? And I just the point being is like, most of life, you won't have a reference for where your effort's actually taking to you. But it's about staying, but like, I guess that's where you come into consistency and trying to break it down. When I was doing the whole St. Helens thing, even though it should have been much easier, I was just like, count to 7, like first step, count to 7. And each time I got 7, I knew I was 7 steps closer to wherever I wanted to go. And it actually became a game where like I spent like, I kid you not, an hour, 15 minutes counting to 7, like just climbing up. Cause we were like, that was like I think we were like 2/3 of the way in, got to that last moment, started counting 7 steps. And next thing you know, I didn't even realize time passed by the end of it. And that's kind of like what people need to do, is even though you're like, there's always that question of reference and like in relation to your efforts, you really just need to still try to take that vision and put into units that you can actually accomplish. And even if you don't have a reference for even for those units, know that that vision is still worth pursuing, right? No matter what, right? I think like another thing about vision is like, it's so good that it's okay to risk. It's okay to fail, right? It's like, it's so good that you need to put as much effort as you can into it, right? And that's just, we got a lot of nihilism these days, right? When you like, I think a lot of people they always think about the cost of something. They always think about the effort it takes. And when you don't have that like kind of transcendent truth, or you don't have that vision that's like getting you out of bed every day, of course, everything is 1,000 times harder and becomes futile. Like the futility becomes more apparent, right?
Yeah.
But it's just, I've had this conversation like a couple times now, just within policy and pushing stuff past in legislator. And it's just kind of funny how like our little esoteric talk here is just always relevant. And like, I really wish I could encourage a lot more people just to have the vision, itemize those goals. And then even if you don't have a reference, keep pushing, keep the faith.
Yeah. No, I think sometimes the more esoteric to talk, the more it reveals itself to be kind of like one of the fundamental rules of many different situations in life, like whether you're trying to pass a bill that's not happening because it would need to be broken up into too many smaller tasks and people aren't doing that, or you're trying to climb Mount St. Helen and it's low visibility. You kind of need to have that you need to know that the effort you're spending is going to be rewarded somehow. And I don't think you can outsmart your own reward system. You got to give yourself some sort of accomplishment along the way, or else you won't get to the top of the mountain.
No, we need our little nuggets. We need our gummy bears. We need those breaks. We know the boxing, right? Like, it's just, I think people, they sometimes don't admit to themselves, but really they're more concerned about having effort recognized than actually getting to an end conclusion, right? I think like a lot, like, sure, we say we're goal oriented and we're ambitious and like we put that at the forefront of the vision, but like really, I think people, even if they fail, they just want to know that like someone else can look at them being like, you still tried hard, or like you put it out on the field. Like, is really, that's what people want to hear. And it's so funny. And it comes to career stuff, because that doesn't always come through and it's sometimes really hard to measure. But I think that's some of the difference here, and like winners and losers, victors and people in defeat, right? Like, you got to keep pushing.
And be honest with yourself to know that that might be the motivation you need. Like, I think there's a stigma about trying to do stuff for applause. But I think that's a pretty primitive drive for human achievement. You need that social feedback. Like how many heroes kind of in the pre-Christian era were all about accomplishing great deeds because of their own personal fame. They were fame seekers. And, obviously today, people don't like think of like they don't have a high opinion of people who want to be like the next Justin Bieber, or I'm gonna go on TikTok and do something stupid because I want fame. But let's say you have like higher aspirations, then hey, is it so bad to like want to be recognized for doing something good? I don't know. Maybe it's not the worst motivator.
I always saw that, like, I always felt like I was put in more grimier positions in the writing world when I was trying to go for broke, just to go for broke, right? Like, or just to get like that one particular outlet, opposed to being like, no, this issue I'm talking about is important above all else. And I actually found out when I focused more on the latter and the quality of it, my writing and its acceptance opened up immensely, right? Like it's like you can try to be timely, you can try to be cute, you can try to get your applause, get the golden star, pat in the back, whatever you need. But like I sometimes just think would like stop being so concerned on the appraisal of your skills by others around you, right?
Yeah.
Focus on the quality of the stuff you offer people, right? The actual value you bring in. Like that to me speaks much more volumes. And it's even though I think like if you kind of play around, like trying to guess like the social impulse, you might have like a fire starter moment. Some people love doing that. And
Yeah.
they gain popularity influence or whatever their particular end goal was. But for this situation, like I'm just saying, like if you focus on quality and people just associate you with always great quality in everything you touch, that's like, you know, if we weren't talking about focus, that's what I just would say is like,
Yeah.
there's so many times I had to reteach myself Excel, Stata, how to do like creative stuff in Photoshop, and then also like revisiting like was it Strunkman White's stylus book for writing and like having to read great classics just so I could actually create a better sentence, put a good graphic next to it, think about the speech and be persuasive, right? Like I did those things and people just come to recognize that like, oh, he's actually knowing he's like this is like so great to work with him. And like I feel like that's like a way I like growing. It also saves me from having to be a slave to other people's opinion, by the way. Like I'd rather deal with the judgment of my product than just the way that I carry myself and like expecting like my personality or the persona and like the stuff that I do because of that persona to be what's like the forefront, right? Like I guess when I want people to mention my quality before my name, right?
Mm-hmm. It's so funny how much competency plays into your own self-sovereignty. It's like
Yeah.
being able to be healthcare literate. It sets you
Yes.
free, you know. So yeah, I mean, I think a lot of people have a lot of work to do on an individual level.
I know we
I
solved them
know.
all though. We solved all the problems though for all the individuals here.
There we go. Yeah, so I think we've accomplished a lot. Um, I think this is a great place to stop, but I know we should probably have a conversation like this again in the future. But for today, Tanner, I want to thank you so much for joining the show and revealing all of this great insight.
Oh, Christian, really appreciate it, man. It was a blast and look forward to talking again sometime soon.
That sounds great. And for you listening at home, if you like this video, like and subscribe, and I will talk to you all later. Take care, everyone.